All right, welcome back to the channel. Today we're diving into something you've probably heard about around physical therapy clinics, but it's dry needling. So we're going to break down what exactly is that, how it works, and who it might help. So starting off with the basics, what is dry needling? And really it's just a technique used by physical therapists where a thin, solid needle, a little bit longer or bigger than an acupuncture needle, is inserted directly into a muscle.
Oh, hell no!
Usually one that's tight, sore, or knotted up that's causing direct or referred pain in a certain area. And the term dry really just means there's no medication being injected. So it's literally just a needle releasing that tension in those tight muscle areas. So a little bit about the science behind dry needling. So what's kind of happening underneath the skin. So when a needle hits a trigger point, which is a tight band of muscle or a knot, it can cause what's called a local twitch response, which is what you're going for.
There we go, there we go.
And that basically causes the muscle to quickly contract and then release. And this twitch response really helps to reset the muscle, improve blood flow, and reduce pain signals to that area. And so what does it help with? And dry needling is really commonly used for muscle tightness, spasms, chronic pain conditions, so especially with the low back, that's what I've used it a ton for. Shoulder pain, plantar fasciitis, stuff like this. Recovery from surgery, especially orthopedic surgeries like ACL or rotator cuff, can be especially helpful, but really any procedure. It can also help with tension headaches, a neck pain, and if you're experiencing limited range of motion after surgery or the muscles feeling really just guarded or stuck, dry needling can really help in those situations.
Look, how big this is? You want me to stick this into my heart? Are you fucking nuts?
And so you might be wondering if this is the same as acupuncture, and no, it's a little bit different. Even though they both use needles, acupuncture is based in traditional Chinese medicine and focuses on energy meridians and much smaller needles as well. And so dry needling is really grounded in modern anatomy and neurophysiology, and it's all about targeting those dysfunctional muscles or trigger points and really trying to improve how your body moves and feels. So dry needling is much more targeted to your specific ailment, whether it's a specific muscle in the low back or shoulder, so much more directly at that area of ailment. And acupuncture is much more holistic, working on those energy meridians throughout your whole body. So you're probably wondering what to expect and how does it feel when you go in for dry needling. So I've had it kind of all over the place in my body, primarily used for low back as well as shoulders, glutes, calves, things like that. It's very effective for releasing stubbornly tight muscles or trigger point areas that are really knotted up. One thing of note is that the adductors and the bottom of the foot are less than ideal, although it's still very helpful, so give it a shot. So in general, you're probably wondering what it feels like.
The sooner you sit still, the sooner we can get this mess over with.
Okay, then can we eat sugar plums?
You betcha. We'll eat sugar plums, gingerbread houses, and we'll even paint eggs.
Well, paint eggs, that's easier.
A lot of people describe it as that they don't feel the needle going in and then they feel a local twitch, so a quick twitch or a deep ache and a twitch. That's kind of what you're going for, releasing those big muscle bodies. If you feel any zinging or sharp pain, that's not really what you're going for. And in general, it's not too bad. If you get something like that, it goes away pretty quickly. And overall, it's very safe and effective. And what to expect afterwards is just some soreness for a day or two.
My shoulder doesn't hurt very much, but my face does. Right here. Not here or here so much, but right here.
And if you've had it for a while or had it a few times, really it becomes no big deal. And physical therapists will even have you work out sometimes right after doing it, right when those muscles are released and your movement patterns are better. So it'll feel a little sore, but generally no big deal, especially after having it a few times, you'll get used to it pretty quickly. And just as a quick bonus tip or heads up, in general, since dry needling is trying to trigger a mild inflammatory response, which helps your body heal, it's not recommended to take anti-inflammatories or ice immediately after. In general, you want to lean towards heat, gentle compress, or just some light movement. And so a little bit of why heat is recommended afterwards. So dry needling creates a little bit of micro trauma, as we mentioned, with that mild inflammatory response. And this is part of the healing process that really releases that trigger point. But with that micro trauma and that mild inflammatory response, it's best to kind of avoid the Advil, Aleve, things like that, and avoid ice for the first few days and really just focus on heat.
Kind of hot in these rhinos.
So yes, hot tubs are ideal. You can hop right into a hot tub. That's recommended by a lot of physical therapists. And because the needles are so small, you don't have to worry about being submerged right after needling like you would with other injections. And so a little bit on why anti-inflammatories are not recommended right after. It's because that anti-inflammatory effect is kind of doing the opposite of what the needling is, which is inducing a little bit of inflammatory effect. So it draws blood flow there. So it's best just to avoid those two if possible, but certainly not a blanket rule. If you're extremely sore or having some issues, feel free free to take some anti-inflammatories or ice, but in general, best practice is to try and just do a little heat and avoid those if possible. So for some quick final thoughts, dry needling unfortunately isn't a magic fix, but when it's done by a trained professional and used as part of a bigger recovery plan, it can really help release those stubborn muscles, speed up healing, and get you moving better. So if you're stuck dealing with some really stubborn tightness in certain areas, or if you're having nerve pain, or if you just feel like you're stuck in a plateau and can't get through a certain situation, definitely worth asking your PT about dry needling and seeing if it can help you get over the hump. And as always, if this video was helpful, please hit the subscribe button. And if you've had dry needling yourself, please throw in the comments anything that helped with your experience or what issues it was particularly effective for. Thanks for watching, and we'll see you in the next one.